It's new tonight. The recent death of actor Chadwick Boseman put a spotlight on colon cancer. Earlier today, Channel 3's Carolina Cruz had a chance to talk to Hartford Hospital doctor David Chaletsky about this type of cancer and some of the symptoms.
Chadwick Boseman was just 43, so we wanted to ask you, are cases on the rise in younger populations, and if so, why?
Yes, unfortunately, cancer cases, colon cancer cases are on the rise in our younger population. In fact, according to the American Cancer Society, those individuals between ages 20 and 39 have an increased incidence up to about 1 to 2% per year over the past several years of getting colon cancer. Now, that translates to about 1 in every 5 cases of new colon cancer diagnoses are in our younger population. Why that is, we're not quite sure. Some people feel that our better screening tools are helping us detect more cancers, and that's rising the numbers. The problem with that is that diagnosing cancer in our younger individuals, we're diagnosing them at later stages, so it doesn't totally make sense. Some other factors such as obesity and diabetes and cigarette smoking can also play a role, but we're really not sure.
So who should be getting tested?
The American Cancer Society recommends that anyone age 45 or older should be screened for colon cancer. Now, if you're younger than that and you have some concerning symptoms, and we can talk about what those symptoms are if you like, those concerning symptoms, then they should consider getting screened earlier.
And what are some treatment options? Because we know this can be a scary diagnosis.
So the good news is we have many, many good treatment options, but the key still is early detection, getting screened early, catching the cancer at an early stage. So, for example, early stages of colon cancer can be treated sometimes with surgery alone for cure. And, for example, here at Hartford Hospital, we even have tools where we can perform incisionless procedures, where we can remove small colon tumors with a colonoscope. And in addition, there are chemotherapy regimens that can be used for people with later stages. So, for example, Chadwick Boseman had stage 3 disease, which is a later stage, and eventually had stage 4. And we have many treatments. Unfortunately, the success rate is just not as good.
Are there any symptoms or signs that people can look out for?
Yes, I think anyone, if you're having any symptoms such as weight loss that's unexplained, abdominal pain that just doesn't make sense and doesn't go away, if you have blood work and it shows that you're anemic, or certainly if you see blood from your intestinal tract, you definitely need to get checked out.
Thank you so much. That was Dr. David Chaletsky from Hartford Hospital. Thank you for joining us.